therapist. Marriage, I am, so you just know my title is Marriage and Family Counseling. I work for the Jewish Board. And through the Jewish Board, the referrals are through ACS, so it's a state referral. What does that mean? I indirectly work for the state. What do? I am one of those advocates that looks out for the interest of the child, the best interest of the child, and make sure that they don't have any risk. Meaning if they're sexually assaulted, if they're neglected, if they're deprived of anything. So I go in to make sure that their environment, their home is safe. And if they have had any kind of trauma, I address that trauma through intervention of therapy, and meaning specifically trauma system therapy. With that said, in my company, I tend to have most of the referrals from the Harlem Upper West Side area, and it's predominantly Hispanic. So what happens, I am the therapist that speaks Spanish, and most of the cases, if not all, are referred to me because I'm the Spanish speaking therapist. I have seen it in both ways. When a client has, or a family has, a therapist that only speaks English and then has translation come in, and that is a big problem. And I've noticed the problem because even though I speak Spanish, when we run meetings, there's some meetings that are important that my supervisor and higher ups come into. I'm not allowed to provide the translation for the clients. So a third party has to come in, and that would be, I'm assuming, some of you. And it is frustrating when you know the language and you're hearing that the translation is not being given appropriately. And it frustrates me. And I have had this conversation extensively with Christina. And I'm like, oh my God, if someone has to teach them that, it's not Google Translate. We can't do this because we're asking very specific information, and sometimes it's lost in translation, and in your hands, you hold the potential of this family. By you misguiding a translation, it might be heard by the state differently. And they're like, oh, no, this kid is at risk, and take those kids out of the house. Or vice versa, being a high risk and you're not expressing that, or you're not relaying that. So that's why it's important. Do you have any questions up to now?
I'm sorry, can you just repeat? Because I think I was kind of out of the meeting for a little bit. What exactly you do for work?
So I'm a therapist. I'm a marriage and family counselor. Okay, and I work for the Jewish Board, but my cases are very delicate because the cases that are referred to me are through ACS. So think of court mandated cases. Think of those that you've seen on TV. Oh, this child's being abused. And here comes the state and investigates. And if they find just cause to keep on the case, that's when I'm called in. So I can assess the safety of the family and the children and provide counseling.
Can you explain what ACS is?
ACS is the Administration of Children and Families for New York State. And what they do is their main interest is to make sure that every child is safe within their home. Every child has food, every child has education. They're not neglected, they're not sexually assaulted or abused in other forms.
Daniela tiene una pregunta.
Yes, I have a question. You mentioned that it's like very frustrating that the interpretation isn't so accurate.
Mhm.
What is it that you do in those situations? Like knowing that it's not accurate, what do you do? What
Unfortunately,
happens?
I have to stay quiet because I can't interrupt, but I squirm. The nice thing for my clients, they have a double safeguard because I do speak the language. I can, no, you misunderstood. This is what she meant to say. And I then will tell the interpreter, please ask this, or, and I'll make sure that everybody hears it. So they're not thinking that I'm guiding it for the client to actually answer in one way or another. So I'm very particular in that situation. And what I think you need to be aware, for the most part, I was born and raised here. I do speak Spanish, but as some of you might have heard earlier, Cristina said, oh, you could do your Spanglish, because sometimes I do. I'm like, I don't know this word in Spanish or English, whatever. And so I tend to do that. So literally Spanish is my second language, not my first language, is actually my second. So with that said, sometimes I don't know exactly the translation of a particular word, but I also have to be cognizant of where they came from. Did they come from Mexico? Did they come from Santo Domingo? Did they come from Puerto Rico? Because not every translation for every word is accurate. So I think as interpreters, you should be a little bit more seasoned and versed with different idioms that different countries use.
Okay, thank you. I have a follow-up question though.
Sure.
Does it affect the case's outcome, like the interpreter?
It does. Like I said, because these are very sensitive, we're dealing with very sensitive issues. Basically, think of, I don't know if you have a child, but think of you're in a store, you hit your child and someone calls a case on you, and then they call that you're abusive. And then these people come in who don't know you and side with the kid like, oh no, you're an abusive mom. And here it is, you have to go through a process of staying on through a program. And
Okay.
you're trying to prove I'm not abusive. It was like, I was just reprimanding my child or whatnot. If things get interpreted the wrong way, there's a potential for this child to be taken out of your home and out of your care.
Okay, thank you.
Glenis?
Sí, hay términos en particular, por ejemplo, yo sé que si vamos a ser intérprete de medicina, que tenemos que aprendernos los órganos, las enfermedades. ¿Hay algunos términos técnicos que ustedes utilizan en esa área?
I'm gonna answer a question with a question. So if I was to say, okay, Miss Flores, I need you to identify your strengths, what would you answer? I want you to translate it in Spanish.
¿Cómo interpretaríais eso?
Quiero identificar sus fortalezas.
Okay. Anybody else? I'm gonna pick on Daniela. If someone says, quiero que identifiques tus fortalezas, what would you answer?
I'd ask what they mean by fortalezas,
Ah,
because a lot
There
of
you go.
things come to mind when you say fortaleza, like that's not.
exactly. So if you're the one doing the interpretation, there's nothing wrong with you turning around and saying, hey, because you're not a therapist, can you explain what you mean by strengths? Because it's actually an easier way to translate for the client that way. And then I would say, well, I mean, strengths, I mean, what are things that they have that they're capable of, such as, are they honest? Are they loyal? Are they tenacious? That makes more sense, right?
Yeah, a lot more sense.
Okay, and that's easier for you to translate, right?
Yes.
So don't be afraid to actually ask, whoever you're translating for, can you be a little bit more specific or give me an example? Because I'm not sure how to translate that so they understand that point.
Okay.
And did that answer, I forgot whose question it was. I told you I was going to answer your question with a question. or an example.
Glenis que quiere, yo creo que como una lista de palabras que se tiene que estudiar. Y yo creo que para este ámbito en concreto, no es algo tan delimitado como si estás estudiando para ser intérprete en un juzgado o en un hospital, que si tienes un campo de vocabulario muy concreto que puedes coger libros y ponerte a estudiar. Pero con la práctica, y vosotras ya sabéis hacer glosarios, sabéis preparar la terminología, cuando te sale esa palabra en un trabajo y no sabes cómo traducirla, la apuntas y poco a poco vas construyendo tu propio glosario y vas a ir añadiendo palabras constantemente.
Now, let me ask you, if I was to ask, ¿cuáles son tus aptitudes? Would you understand that? Not everybody answer at once. Thank you. You know, I don't want to put anybody on the spot here.
It, I
Yes,
wouldn't
I would.
I wouldn't understand what that means.
Okay. So, I mean, again, and I know it's a lot of different dialects that you have. A lot of regions, you know, Argentinians speak different than Colombians or Venezuelans or Mexicans, whatever. So for my purposes, and for if you ever end up working for translating for ACS, don't be afraid to say, can you be more specific in that so I can provide the best translation? That would be my biggest advice to you.
Y esto, chicas, quiero que penséis en esto que os acaba de decir Yoli en relación con los códigos éticos que estudiamos en la clase. ¿Veis que si hay algún problema? ¿Recordáis que el código ético que nos dice? Que tenemos que ser fieles al discurso original. ¿Veis si hay algún problema entre lo que nos está diciendo Yoli y el código ético?
Sorry, that was by accident.
I was like, Spanish research. I'm like, would you want me to research something in Spanish?
I do have a question for you. So I'm
Sure.
currently in a study with a professor here at John Jay, and we're actually studying this topic. The name of the study is called Loss in Interpretation. And we're basically we're interviewing clinicians as well as interpreters within the work they do, and you know, trying to see what things they struggle with, what things they like about interpreters. And I was wondering maybe if you would like to, I was just trying to figure out if I could share the flyer. So I accidentally put in the chat, but I was gonna ask if maybe that would be something you'd be interested in, because we're still recruiting people.
So you want to recruit me for something else?
No, I'm just sharing the flyer so you could take a look. Sorry, I meant to ask later on, but I was trying to figure out if I could share the flyer, and I didn't mean to.
Who are you doing this with, Kimberly?
Professor Rebecca Weiss and
Uh-huh.
Aida Martinez Gomez.
Yeah.
Okay, I promise I will take a look at it, you know, later on, but you know, I'll keep you posted. I will let Cristina know and she'll let you know, okay? I to be honest, and she knows, like this time I'm actually in client's home. So I'm like, I actually like saved up this chunk of time for you guys because I usually work. So just so you know, the other thing that I wanted, and I had spoken to Christina about, sometimes, and I don't know if some of you have dealt with this experience, when you're working with medical staff, some doctors, you know, you gotta love them, but they have this, I am here, you are here. And I am God and you're not. I am knowledgeable and you know nothing, you know, and they have that power mentality. And you can see it come through when they talk down to their clients, or what I call their patients. And I had one particular incident when I was present in a meeting, another meeting, where my client was talking to her psychiatrist. She speaks, and correct me if I'm wrong, it's another language. Cristina made me aware of this. Mixteco,
Ujú.
am I right? So I said dialect, but she was like corrected me, and I'm like, no, it isn't. It's a language. Okay, it's a language. Anyway, but obviously she's learned some Spanish because Spanish is easier for most people to understand, or she figured more people would understand me in Spanish, and I probably have a higher likelihood of having translation versus Mixteco. Long story short, the psychiatrist was getting very frustrated and flustered with this person because she would ask a question and then the translator would translate. And of course, the translator is trying to do the best job possible. But then the answers the woman was giving was just not making any sense. Like, for example, if I say, how much is 2 + 2? And then, after translation, I answer, sí, el otro día yo comí queso. You're like, wait, I asked how much 2 + 2, what does that have to do with you eating queso? It's like, it don't make sense, right? But they weren't aware. I had taken the time as a therapist to explore because I did see that cognitive, she's not understanding me, what's going on. And I keep on explaining it. And it took me a while to figure out that she spoke another language. It was like, once I did that, I'm like, oh, okay. And then my sessions went quite easy with her. But this person had not done so. Because again, she was relying on translation. And the translator is not going to take time to like, oh, let me figure out why is she not understanding this? She's just going to translate what the lady said. And then the psychiatrist was like, what? Long story short, in one instance, the lady was supposed to be giving her daughter a certain kind of medication. But again, lost in translation, she misunderstood this medication is twice a day, this one's once a day. And basically was not giving the medication appropriately. And you could hear the yelling going already by both sides. Till I couldn't shut up anymore. And I intervened in the conversation because the psychiatrist said, read me what's on the label of the pills. And I was like, this lady can't read that. So I took the pills and I'm like, I'm sorry, but I know I wasn't supposed to cut in, but here's what it says. It says, take 2 times a day. It's in English. How is this lady supposed to understand this if she doesn't even speak English, let alone Spanish? So it's another, I mean, you could see how even sometimes, even within medicine, we don't realize simple things as putting labels or actually requesting the pharmacy to put the labels in that person's language. And that's a request that has to come from a doctor. I know it was a long story, ladies.
That was very interesting.
Yeah. But here it is. She's supposed to be giving this medication to her daughter and it's not being followed appropriately. So, I mean, you could see the trickling effects of miscommunication, non-communication. And it literally, once I stopped that doctor, and I mean, I yelled at her and I was like, you're very rude, whatchamacallit, and I explained to her, do you realize that this woman, and she's like, oh, I'm like, oh, now it makes sense.
Yoli, ¿quién contrata a los intérpretes para ACS?
I don't know how they are hired. The process they do that with, I have no idea. I do know that, and I'm gonna think that they probably have a process, because for the people that go out and do the research, like go into the people's homes, there's a test. And so I'm gonna, and I'm almost positive, I could put my hands on fire, that probably if you come in as an interpreter for ACS, you would probably take some kind of a test. But usually they hire outside agencies. They don't like to do a lot of things in-house. They like to resource them out.
Ujú. Ujú. Yo cuando trabajé para el Department of Child Services en Indiana, era a través de una agencia. Y la agencia me llamaba y me dice, vete aquí o vete allá, en función de la necesidad que tuviese. Un
See,
problema.
and I can, well, I mean, I can't show you, but uh, when we have these meetings, when you're translating, oh, by the way, right? Because chances are we'll ask you to interpret documents afterwards because you need to interpret them back so the client knows what we were talking about.
Ujú,
So that's another thing you should be aware of. I
ujú.
was trying to.
Ellas saben, el semestre pasado, eso se llama traducción a la vista, sight translation.
No, but like when you're doing the translation, and I'm sorry because sometimes they should inform you. But then you'll get like, oh, we need you to translate this document after this meeting. And you're like, wait, I didn't take any notes. I was like,
Pero traducir el documento y escribirlo
translate, yeah.
o
You have to
leérselo.
No, you have to translate it into the language. O sea, esto se hizo en inglés con la traducción,
Ujú.
pero se tradujo todo al español. Para uno
Te
dárselo al
piden,
cliente.
pero, esto es la diferencia que no sé si alguna vez hablamos de esto. La traducción es escrita y la interpretación oral. Y
Ujú.
normalmente o haces uno o haces lo otro. Aquí las
Muchas-
chicas tienen formación en las dos cosas, pero la gente después en muchas ocasiones se especializa. Un intérprete podría hacer esa traducción, pero claro, eso lleva tiempo y lo tienes que hacer, o sea, tienen que darte tiempo y tienen que pagarte por eso.
No, sí, por supuesto. O sea, estás en la junta y después todo lo que llaman los minutos o the minutes o whatever you
Sí,
want to
sí,
call it,
lacta, sí.
eso, la persona que te contrató te dice, mira, listo, mira, ya yo llegué, hice el documento, esto fue de lo que hablamos ese día. Necesito que lo traduzcas para yo poder dar al cliente, pero en el idioma de ellos, porque pues obviamente no se los puedo dar en inglés.
Ujú. Ok, entonces si algún día hacéis este tipo de interpretación, sabed que os va a tocar hacer traducción también. Son las dos.
Doble, o sea, oral y escrita.
Escrito los documentos. Un problema que veo yo, y esto se habló mucho en el congreso en el que estuve en California hace un par de semanas, es que muchas veces los códigos éticos de traductores e intérpretes que nos dicen cómo comportarnos en la profesión para que funcione bien, una de las cosas que nos dicen es que tenemos que ser invisibles. Entonces yo me limito a cuando escucho what are your strengths, traduzco cuáles son tus aptitudes y cuáles son tus fortalezas. ¿Vale? Y tú lo que nos estás diciendo es, bueno, si dices esto, no te van a entender, ¿no? Entonces, hay un conflicto ahí entre lo que te dice el código ético de tu profesión y lo que tú sabes que de verdad funcionaría. Y lo que estamos viendo en el campo de investigación de la traducción es que va a haber que cambiar esos códigos éticos para que de verdad la traducción y la interpretación funcione y que nosotras como intérpretes tenemos mucho conocimiento de las dos culturas y podemos ayudar, que no somos tan invisibles, podemos ayudar a que esa comunicación funcione de verdad. Lo que pasa es que esa función del intérprete como en la que podemos intervenir y decir, no, esto no se está entendiendo, hay que aclarar, se puede hacer en ciertos entornos y en otros entornos quizá no se puede hacer como podría ser en un juicio. ¿Vale? En
Un
un
juzgado,
juzgado,
es literalmente traduzca lo que escuchaste, pero en estos casos cuando son tan, y creo que es una cosa que deberías de aclarar con la persona que le vas a traducir. En el momento que te pones, y casi la mayoría, obviamente por COVID, se están haciendo vía Zoom, Team Meets, diferentes. Entonces, en el momento que tú te montas a la plataforma, decirle, ¿qué clase de interpretación quieres que haga? Invisible, o sea, traduzco y no, o sea, no pregunto para clarificación o lo que tengas que hacer, pero, o sea, es algo que yo personalmente haría.
y lo que también quiero que penséis, chicas, es que vosotras tenéis mucho conocimiento cultural que os va a ayudar a hacer ese trabajo bien, ¿vale? Porque sois, a todas las que estáis aquí, venís de distintos países y estáis en contacto con gente de muchos países de habla hispana, ¿vale? Entonces, conocéis palabras de esto se dice así en México y se dice así en Colombia, ¿vale? Todo ese conocimiento es muy útil cuando tenéis que interpretar.
Perdón
Daniela,
que yo te
sí.
interrumpa, pero hay un Carlos y hay un Vicente y no creo que sois mujeres, you.
No, pero si hay mayoría de mujeres se puede utilizar el femenino y ellos dos.
No
Sé que
los quiero,
Vicente,
no los quiero dejar aparte, muchachos, los tengo presentes.
pero yo sé que ellos, Vicente es mi jefe y Carlos sabe que
A
lo
mí,
apreciamos
a
mucho.
mí me encanta que me incluyan en chicas.
Ah, ¿ves?
Buenísimo todo, gracias.
Daniela, ¿tienes una pregunta?
Yeah, I have a question. Um, about the code of ethics.
Ujú.
You're saying that we have to have like a loyal translation to what we're saying, but if they're not understanding, then is it really a loyal translation? Because then you're not getting the message across.
Exacto.
So is it really breaking the code of ethics if you make sure that they understand rather than just translating as they're speaking?
Exacto, o sea, no hay una respuesta. Esa pregunta que haces es buenísima y te daría para hacer una tesis doctoral sobre ella.
And I'm going to answer it from the perspective of I'm in need of your translation. I would not be offended if you turn around and you ask for clarification, because at the end of the day, it's going to get me to be able to service that family the appropriate way. I
Yes.
think that, asking, and for me in the therapy world, when you ask both parties for permission, you're not being unethical because you're asking for permission from both parties.
Okay. Okay, thank you.
Y esta parte de comunicarse con las dos partes de la conversación es importante, ¿vale? Tener en cuenta que, y quizá en un entorno médico también fuese importante, ¿no? Porque si le preguntamos, de hecho en la conferencia dieron un ejemplo de un médico que estaba haciendo las preguntas rutinarias al paciente y una de las preguntas era, ¿tiene alguna enfermedad congénita? El intérprete era médico en su país de origen, no me acuerdo, venía de Latinoamérica, no me acuerdo qué país, y ahora vivía en Estados Unidos y se dedicó a la interpretación en lugar de seguir siendo médico. Y el intérprete, en vez de preguntar, ¿tiene usted alguna enfermedad congénita?, le hizo una serie de preguntas porque sabía que si decía enfermedad congénita el paciente no le iba a entender. ¿Vale? Entonces, tiene problemas con el hígado, tiene problemas con el estómago. Hizo la interpretación, preguntó muchas más cosas que la pregunta original, que eran unas pocas palabras, pero se aseguró de que el paciente entendía bien la pregunta y de que el médico obtenía la información que necesitaba. ¿Vale? Entonces, es importante saber cuándo podemos tomar ese rol más activo dentro de la interpretación para asegurarnos de que la comunicación fluye y que quizá esa aproximación a la interpretación no sea adecuada en todos los casos. Hay que tener en cuenta, como lo estudiáis en las clases de traducción, que el contexto es muy importante. Dependiendo del contexto en el que estemos, vamos a actuar de una manera u otra. Y eso es algo que tenemos muy valioso los traductores y los intérpretes, ¿no? Que sabemos entender bien cuál es el contexto y en función de eso actuamos de una manera u otra.
I have a question for you. And here's another question. Another thing that I've found during when there's interpretation is, and I have colleagues that are very long-winded. And by long-winded, they talk and talk and talk, and they don't give you, they don't break, and they gave you like a whole page, and I'm like, how's that person supposed to remember all that to interpret all that? In the settings where as where I'm working, I think it's very apropos, and I would challenge you all to, when you just about to start, make guidelines as to your interpretation. So I can be an effective interpreter. Please limit your sentences to like 5 sentences max and allow me to translate that. But like the long book, it's, I want to make sure that I give an accurate and precise translation. Does that make sense to everybody?
Esto es importante porque sobre todo al principio, cuando empezamos a trabajar, como que nos da vergüenza de, no, yo no sé, yo soy la nueva aquí. Y seréis la nueva, pero tenéis mucho conocimiento sobre cómo funciona la profesión y cómo hacer que la comunicación fluya y funcione bien. Y ese es el objetivo, ¿no? Entonces, podéis explicarle a la persona que quizá no esté acostumbrada a trabajar con un intérprete cómo se puede hacer. Entonces, es normal, antes de que empecéis a interpretar, decirle cuáles son las normas, por ejemplo, lo que acaba de decir Yoli, de no hables más de 5 frases, porque así me da tiempo a interpretar y decir correctamente lo que dices. ¿Tiene sentido esto? No sé si hay alguna duda respecto a lo que estudiamos en clase. Estáis todos ahí calladitos, calladitas.
I hope you all know that I was a teacher too, so I like to pick on people.
¿Cómo llegaste a ese trabajo, Yoli?
A
¿Qué
teacher?
estudiaste? No, al que tienes ahora.
No, I went to school. Here in the United States, you study for a long time. Like, you go to school for a long time, you acquire a lot of loans, and then you're like, oh, now you're this. I'm like, oh, thank God, after 10 years. I mean, it'd be nice if I'm something.
¿Qué estudiaste y dónde?
Marriage and family counseling, and my master's is from Nova Southeastern University. And I see a question from Veronica.
Hola, ¿cómo está? Buenas tardes. Yo
Buenas
tengo una
tardes.
pregunta. ¿Cómo es que usted maneja o aprendió a manejar sus emociones cuando tenía un caso difícil a la hora de hacer interpretación?
Well, I deal with very sensitive cases. I mean, I'm going to give you a graphic detail. I've had a child, 7-year-old child, tell me how she was sexually assaulted in detail. And I squirm because I'm like, just hearing it, I'm like, I can just imagine the pain. So it's very hard to work with those kind of cases. And it's very hard to hear it. And this is as a therapist, this is me telling you as a therapist, when you're doing interpretations for those kinds of cases, don't overlook your mental health because they are stressful to hear. And what I invite you, after you do your translation, you're done with, the session of translation, take a moment and analyze, how did that make me feel? And acknowledge that you have the right to feel that way. Scared, traumatized, whatever it is. And then I would tell you to go to a happy place or do something that makes you utterly happy. Be it you love to have a glass of wine, you want to go and, lay in, but maybe you're going from translation to translation. So maybe have a playlist ready that calms you down. Because sometimes, like I just said, you're going from translation to translation, but do take at least 5 minutes, acknowledge, how did this make me feel? I'm kind of not feeling, I'm feeling stressed, I'm feeling overwhelmed, my heart is beating. Okay, let me go to, and I'm just giving you an example. I'm using this playlist to calm me down, to soothe me, to make me sad, and then I can continue with someone else's translation. Did I answer your question?
Yes, thank you.
Yeah, see, that's how Yoli and I met in our happy place. We met dancing.
We danced.
¿Tenéis más preguntas, chicas?
I think they're interested about my job.
I knew they would. Stephanie.
Stephanie.
Hola, yo quería saber cómo sabías, cómo usted sabía lo que quería estudiar como mental health counseling de ahí.
Oh my God, girl, don't ask that question.
Like,
Okay,
like
just
you
so
were
you-
sure, because
Just so
I've
you
been
know,
thinking. And
and Christina knows it. I'm what do you call a jack of all trades. I have been a physical therapist, so I did study physical therapy and I did practice physical therapy. I have been a teacher. I was a teacher for social sciences for grades 9 through 12, so I had the difficult. I have been a counselor in schools and now I'm a counselor for ACS. So I've had a lot of jobs. So it wasn't like I knew that I wanted this. I've always loved, I have an ability and what I call, you know your talents. And my talents have always been to connect to people. I mean, Christina can tell you, you meet me and you're like, oh my God, it's like I know her forever. No, you don't. Yeah. And people start talking to me and telling me their problems. I'm like, why? I don't get it. You know, it's like, really don't get it. So I knew I had that ability to engage people. And again, I've done a lot of I've always been in the service industry, if that makes sense, because I know that that's my talent. But interpretation is just as important. And please realize that you have even a more important job than anybody else, because if it's not for you, nothing would get communicated.
Carlos.
Buenas tardes.
Buenas tardes.
Solamente quería pedirle, quizás no sea posible, pero me gustaría pedirle, no sé, un contacto para todos nosotros, porque realmente siempre es bueno escuchar la voz de la experiencia. Cuando en estos tiempos nosotros todavía nos vamos a graduar, estamos pensando qué vamos a hacer y siempre tener un contacto, que no es que la vamos a estar molestando todos los días, pero por lo menos una vez nos dé una guía, siempre es bueno.
A mí me encantaría y con mucho gusto, yo no tengo ningún problema, and I'll put it in the chat. Just, you know, si lo pongo en el chat, por favor, mándenme, porque yo llego y miro, ¿quién es este? Yo a este no lo conozco. And Cristina can tell you, I'm like, no lo conozco, adios, you know, and I might not answer you. So, you know, just say, oh, you know, you presented for John Jay. And I'm like, oh, okay, now I know. And email, do we want email? What do we want?
Yeah, an email would be fine.
Oops. Does anybody have another question? I see hands going.
Kimberly.
Yeah, so you did mention before that for the most part, like the interpreters you get are from, I guess, randomly chosen agencies or whatever. Do you ever have like difficulties, like maybe use certain terminology or something that the interpreter doesn't understand, so they can't really translate and they have a hard time with that?
I just gave you a clear example, the strength, that one. That's like one of my biggest ones. I was like, no, that's not what she asked, you know. O cómo se mantiene. I'm like, what do you mean, cómo se mantiene? Like, yo me mantengo parada, you know. It's like, I mean, that's like my answer, you know. It's like sometimes their translations are like, oh, okay. But then there are other people that do wonderful translations. You know, again, just be true to what they're asking and try to be cognizant of what they're saying. And if you don't understand, there's nothing wrong. At least if you're working with the Department of Children and Family, and trust me, they're going to appreciate you for, can you give me clarification or an example of it? Because we know, oh, you're trying to do an accurate translation for us. Stephanie.
Creo que no había bajado mi mano,
No he bajado la mano de antes.
pero I have another question. last year yo estaba tomando una clase de consejería, creo que era el primer nivel o el segundo. Y algo que a mí me tomó muy difícil fue que cuando está haciendo counseling, uno no puede dar su consejo. Si alguien viene, no puedes decirle, yo si fuera tú, o si fuera usted, debería hacer esto. And that was so hard. Yo pensaba que cualquiera podía ser consejero, consejera, consejero. Y no, porque dejándole saber a la persona o al cliente o paciente los efectos, causa y efecto, sin tenerle que decir, oh, esto es lo que usted debería hacer, o what you supposed to do.
Stephanie, I'm going to give you a one-on-one on counseling. Yes, you can give someone advice. You know how
Okay.
you do it? Oh, you know what? The other day I had a client and they were having a similar experience that you were having. And you know, they did this, that, and the other thing. But I also had another client that did this. So you're not telling them what to do, but you did. Did that make sense?
Yes, thank you.
You're welcome. There's ways, I mean, we're creative human beings, and there's ways to get around. Language is so rich that there's ways to get around things. And that's a clear example of one.
Bueno, creo que te vamos a dejar continuar con tu trabajo.
Thank you.
Muchas gracias por la charla, Yuli.
Muchas de nada.
Creo que les gustó mucho.
The thank yous, no problem.
Sí, yo sabía que les iba a gustar.
Empezamos con 3 y mira con el montón que terminamos. Espero que todos tengan una feliz tarde. Entreténganse. De-stress from my talk, please. You know, send music or something. Go dancing. You know, a glass of wine if you choose to. But thank you very much, and I appreciate you all listening. And I forgot, Kimberly, I will take a look at the file you sent me and we'll get back to you. Okay?
Okay, thank you so much.
You're welcome. Have a great day.
You too.
Bye-bye.
Chao.
I'm trying to download this.
A ver, voy a abrirlo yo también.
Move to download, no, desktop. I'm trying to, okay. Okay, move. Creo que ya lo moví. Because if I close it, lo pierdo.
Ah, es el flyer para participar en el estudio.
Ujú.
Y una de las profesoras de la investigación es compañera mía, Aida, también es profe de interpretación. Y la otra, Rebeca, ¿es profesora? ¿De qué es profesora, Rebeca?
Psicología forense.
Ajá.
Okay.
All right, thank you. Have a good one.
You too. Thank you for the information. And again, I'll let you know through Cristina.
Okay, thank you so much.
Have a great one.
You too.
Bye-bye. ¿Viste? ¿Estuvo mal? ¿Dije algo malo?
No, todo muy útil. Y no, yo creo que les gustó mucho. Y se veía que tenían preguntas y, ay, eso. Carlos,
Oiga,
Carlos quiere ser tu amigo.
Ajá. ¿Quién?
Carlos, el chico.
Sí. Ay, sí, pues ya vi.
Uy, a él, si lo dejas hablar, habla y habla, le encanta hablar.
Pero por eso cuando iba a poner el teléfono dije, email's
No,
okay,
mejor.
right?
No, mejor en email. Sí.
Sí, no,
Pero él no es, él es respetuoso, no te va a
no,
molestar.
pero igual, pues yo la pensé como 2 veces. Yo, bueno, email I think is good.
El email está bien. Y lo del estudio, mira, te pagan $150. No sé cuánto tiempo, pero les puedes, me sería guay si pudieses participar.
Yo trato de ver a ver si, cómo puedo. Igual, no sé si te comenté que ya
Sí,
empecé.
espera, que estoy grabando.